As soon as the final FDA emergency authorization for the Pfizer vaccine comes through, waiting in the wings, your neighborhood pharmacy. CVS and Walgreens are working with Pfizer and the U.S. military to get the first vaccines to healthcare workers and the most vulnerable. Bob Woodruff has the details.
An historic vote today. A group of independent FDA advisors overwhelmingly recommended Pfizer's COVID-19 vaccine, the quickest development of a vaccine ever.
And that concludes the vote. So we do have a favorable vote.
17 of the 22 advisors voting in favor. And for those most at risk,
it was Christmas Day to me. I was so happy because I thought, this is my ticket out. This is my ticket back to normality.
now the decision goes to the FDA, which could issue a final emergency authorization within days. With those early limited doses likely to be reserved for healthcare professionals and nursing home residents, hospitals and long-term care facilities already gearing up.
We expect to be able to go to every single facility that has selected us as a partner within 3 to 4 weeks to provide the first dose.
Pharmacy giants CVS and Walgreens are standing by to help get the vaccine out to the people who need it most.
So this is a list of the long-term care facilities that have actually selected CVS.
People like Lynn Pixler, a resident of Symphony in Chesterton, Indiana.
We'll be working with the CVS pharmacy, and they're going to come and do the vaccinations here at Symphony. So I'm looking forward to it. I one more chance to go on and bug my kids a little longer.
And while the military is helping orchestrate the nation's largest mass vaccination campaign, civilian doctors, nurses, and pharmacists will be the ones to give the shots.
It will still be your local pharmacist that is administering the vaccine. It is the person that you know across the street that you've trusted for your prescriptions that will be providing the service.
The government says it has about 3 million Pfizer doses ready to ship as soon as the FDA grants authorization. And it's sending those precious doses administered first to healthcare workers and nursing home residents. As vaccine manufacturing scales up, vaccine will be made available to all seniors, all people at high risk, and eventually to all of us.
It's a hope, not a fact, is that we'll be able to have access for the broad population sometime in the April or May timeframe of 2021.
The biggest thing that I would ask all of our patients to do and all customers is we need to be patient. We know that there's only limited vaccine, and it's going to be really important that those that are at highest risk get the vaccine.
Though your turn is optimistically months away, both Walgreens and CVS will soon update their apps to determine your eligibility and eventually make an appointment.
There'll be an easy banner just like this one here, right? Get your COVID-19 vaccine, schedule now.
CVS's Senior Vice President of Health, Chris Cox, gave ABC an exclusive look at what their app will look like.
And then we want to educate people right there, right? That, hey, this is not, a one and done shot. This is a round trip ticket. You need, two doses for this to be effective. So we will have capabilities for people to be able to reschedule their second dose. Our systems all talk to each other. So if someone is in New York for their first shot and Florida for their second shot, they would be able to get both, vaccines from us with the system completely tied together.
And Pfizer won't be the only option. Soon, officials are hopeful we'll have FDA-authorized vaccines from Moderna, then AstraZeneca, and next, Johnson & Johnson, with even more vaccines still in the pipeline.
Whether or not people are able to choose, which manufacturer they'll get is really going to be dependent on vaccine availability.
Experts expect in the beginning days demand will outpace supply, largely due to the positive data posted by Pfizer and Moderna.
And when I heard the two of them with the 90% and 95% efficacy, I was so impressed. So you couldn't, that day I don't think I needed my wheelchair. I was floating.
This is Bob Woodruff, tracking the race for a vaccine.
Our thanks to Bob Woodruff for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.